I think it's a good example of privilege.
It seems a bit slippery.
I think it's kind of sad.
This is the couple at the center of it all. Rodney Baker, now former CEO of the Great Canadian Gaming Corporation, and Ekaterina Baker, a Russian-born actress. It's believed the pair flew from Vancouver to Whitehorse on January 19th. 2 days later, skipping the mandatory 14-day quarantine, the Bakers chartered a flight nearly 500 kilometers away to Beaver Creek, Canada's westernmost community near the Alaska border. That's where they allegedly lined up outside one of these mobile vaccination clinics, posing as workers of the local motel. Staff who actually work at the motel are incensed.
We live in a community of 80 people. We know who's in our town. They put us all at risk. They thought they had enough money to be able to buy the system. That's the scary part.
But the biggest red flag came after the two were immunized.
But then as they were leaving, they said, could they get a lift to the airport? Of course, the vaccine clinic folks said no, because they're working to vaccinate people. That's not what they're going to be doing. But that sounded very strange to the teams.
And after that, officials were tipped off.
They went to the airport and found this couple boarding a flight to leave the Yukon to head back wherever. And that's when they got charged.
Copies of the tickets show they were charged with 2 counts each of failing to self-isolate and failing to follow a declaration. Each charge comes with a fine of up to $500 or 6 months in jail, or both. CBC News has reached out to the couple for comment. We haven't heard back.
I think they should be ashamed of themselves. They put a community at risk for their own benefit, and that to me is appalling.
BC health officials voicing the frustration felt by many who are still patiently waiting their turn to get the vaccine. Tanya Fletcher, CBC News.
Highly anticipated Phase 3 trial results for yet another candidate that has been pre-purchased by Ottawa, Johnson & Johnson's single-dose vaccine. It's shown to be less effective than the Pfizer-BioNTech and Moderna jabs already in use here.
Well, guys, here's some big news. Earlier today, Johnson & Johnson announced its single-shot COVID vaccine has completed its global trial and will soon be available. Yep, Johnson & Johnson said their vaccine was proven to be 66% effective. Wait. Way to go. 66%. Pretty much the D student of the vaccine world. Not failing, but would really like to bump that average up to a C+ by next semester. Yet the Johnson & Johnson vaccine showed up late and it got a 66%. It's basically the Spicoli of vaccines. If you're worried about the results, keep in mind Hot Pockets were just recalled for being 66% glass, and Americans still ate them. The Johnson & Johnson vaccine is still considered effective, and it does have some good things going for it. Listen to this.
This vaccine is different. It's 1 shot, not 2, and it also does not need to be kept in those near freezing temperatures like the other 2.
Yep, unlike those Pfizer and Moderna vaccines, you got to wine and dine. The Johnson & Johnson one will hook up with you in a back alley.
Variant strains of COVID-19 in Canada, health officials are urging everyone to think about the masks they are wearing. On cbcnews.ca, read what difference a 3-layer mask can make and learn why medical professionals believe they should be worn outdoors. The advice: it's time to step up mask wearing, even with new cases slowing in many places.
So I have 2 different types of masks here. I have a surgical mask or a medical mask, which you can get from different drugstores and different stores around the cities and Canada.
It's the 3-ply. They call it, it's 3-ply, right? It's like a 3-ply mask, right? Okay.
Exactly. Yeah, exactly. And then I do have a cloth mask as well. That's 3 layers. This was made locally, and it does have a pocket where you can insert a filter. But the way that I asked for the woman to make these for me was to put the polypropylene layer in for me. So she sewed that in, and that's one of the layers in addition to paper towels that's recommended by Health Canada. And so that's the cloth mask that I have.
And this shouldn't be overlooked. The Johnson & Johnson vaccine is the only one that promises no tears if it gets in your eyes. Meanwhile, as the virus continues to surge and new variants arise, experts are encouraging double masking for increased protection against COVID. Not exactly the big medical breakthrough I was hoping for. 11 months in, someone's like, 2 masks? I'm going to go to lunch. Oh, and if you wear those flimsy blue ones that come in packs of 50, they suggest you wear all 50. But Dr. Fauci supports wearing 2 masks. In a brief statement, he said,
Tudo vai ter variante pro resto da vida e a gente vai ficar dentro de casa, apavorado, trancado, porque tem uma variante? Não sei. Não.
Eu sou a favor que se permaneça a praia aberta, sim. É o único lazer que as pessoas têm. A gente sabe que a contaminação na praia ao ar livre é mais difícil do que dentro do elevador, do que dentro do ônibus, dentro do metrô.
With regard to the vaccine, on Wednesday, I spoke to Ursula von der Leyen, the President of the European Commission. She confirmed that measures taken by Europe will not affect the delivery of vaccine deliveries by Pfizer and Moderna to Canada.
Affecting many countries, including Canada, for the next shipment of the Moderna vaccine, which arrives next week. We will receive 78% of the expected amount, translating to 180,000 doses. I want to be clear. We will always share the most accurate information we have, but in the short term, those numbers can fluctuate. But as global production continues to pick up, there will be more stability in the system. And most importantly, this temporary delay doesn't change the fact that we will still receive 2 million doses of the Moderna vaccine as planned before the end of March, as we've been saying for months. On vaccines, I had another call with the global CEO of Pfizer, Dr. Albert Bourla, who confirmed yet again that we are still on track to receive 4 million doses of their vaccine before the end of March. We also talked about Canada receiving more doses ahead of schedule starting in the spring. We'll have more details to share on that next week. Production lines around the globe are adapting to high demand from every country. We are focused day in and day out on getting a vaccine to every Canadian who wants one by the end of September, and we are very much on track to do just that.
The news for traveling is completely normal, considering that you shouldn't travel. Of course, personally, I'm not traveling just to travel, but because I have to. But I think like going in quarantine while you come home is fine, and having to stay at a hotel for 3 days waiting for your result is fine too. And obviously having to pay for it is, I think it's fine too, because you decide to go. So for me, it's fine, and at least it's not like 14 days in a hotel where you have to pay all the way. So I think it's a good compromise. We were expecting actually that since Legault wanted a full quarantine in hotel, that we would have to. So I'm kind of relieved that it's only 3 days. But I mean, I was thinking about not going, then going, not going, then going, but I had no choice. So overall, I'm quite happy with the new restrictions.
You know, it was unexpected, and it's really something that we have to deal with it, unfortunately. Not everybody would have the means to stay isolated for 3 days. The means by that, I mean, not everybody will have enough money to pay for that. You know, I'm just, for me, it's not something they should have. I can understand it's for security, but they also have to think about those people coming here. They could maybe just tell them not to come over. That would be the simple solution for me, I think.
January has become the deadliest month of the pandemic so far, with at least 80,000 deaths in the United States, and the month is not over. The United States has about a fifth of the deaths and infections in the world. On Tuesday, President Biden announced plans to acquire another 200 million doses of COVID-19 vaccines with a goal of vaccinating most people in the country by summer. But the Biden White House is facing a crisis after the Trump administration left no plan for distributing vaccines. In addition, millions of vaccine dosages have apparently gone missing. The Daily Beast reports about 41 million doses have been handed out to states, but less than 22 million have been administered. This is based on data from the Centers for Disease Control. Meanwhile, many states report running out of vaccines.
RCMP allege a man intended to kill or seriously injure the premier and other local candidates. As Ross Lord explains, the suspect led police on a high-speed chase, which ended with a disturbing discovery.
For Newfoundland and Labrador Premier Andrew Furey, being targeted by a man with a truck full of knives is an alarming threat.
We've seen some negativity throughout this campaign and some different, perhaps more online issues than we ever thought we would in the past. And to see an event like this, an incident like this, was very troubling to me and my family. We learned from the police that I was the likely target.
RCMP say Furey was not the only politician in danger.
The RCMP had serious concerns for public safety, including the safety of the sitting MHA for the area and political candidates.
RCMP say the accused left the community of Bond Bay in a truck, saying he was going to Deer Lake, 67 kilometers away, to stop the election. Police say they found the truck near the community of Cormac, but the driver refused to stop, continuing toward Deer Lake at a dangerous rate of speed. They say the truck stopped at a Deer Lake business that contained the office of a PC candidate. Police arrested the man, seizing 36 hunting and tactical knives inside the truck. Police say after they stopped him, the suspect threatened to execute local politicians.
66-year-old George Brake has been charged with the following criminal offenses: possession of a weapon dangerous to public peace, uttering threats to cause death, dangerous driving, and flight from police.
Brian Albert is infuriated that protesters sat up outside the home of Chief Medical Health Officer Dr. Saqib Shahab on the weekend. Police are investigating whether it qualifies as harassment.
Idiots, stupid. It's crazy.
Albert's 98-year-old mother contracted COVID-19 in a long-term care home, and he has no patience for anti-maskers.
First of all, they should be the last on the list to get a vaccine, including their family members, and they should all be made to go work in one of the care homes or the hospitals. They don't have to be a doctor. Let them go wash the floors.
Shahab is far more restrained in his response, just as he was last month when an anti-masker made racist comments at a rally.
I can't get these foreigners' names right.
Shahab says vigorous debate is critical to democracy in a respectful way.
I feel sorry for my good neighbors who didn't deserve to be harassed like this, and also for my family who doesn't deserve to see and hear these kind of comments.
What we saw this weekend was a protest that moved from protesting a government decision to protesting a person. That isn't us in this province, and it needs to stop.
Today, the Premier extended current restrictions, which place some limits on businesses and households for 3 more weeks.
Really stifles.
This psychiatrist says support for Shahab should not silence debate, including criticism of Shahab's public health orders.
The voices that are the loudest tend to be the ones associated with
racism or conspiracy theories. And so if you have legitimate concerns, that may not be a cause you want to associate yourself with.
I think we do need to reach the people who they say, well, I'm not going to these protests, but I am going to visit my brother.
As for Brian Albert,
I'll toe the line.
public health officials have his complete support.
For months, Ontarians have been urged to stay home and avoid all non-essential travel. But international flights continue to arrive in Toronto, and despite rules requiring a negative test, some of those flights are carrying people infected with COVID-19.
A spokesperson for Canada's transport minister told me today that international arrivals by air into Canada are down 33% this year. However, the numbers also show those who are traveling are bringing COVID-19 back with them into the country. This plane landing at Pearson International arrived from London earlier this afternoon. It's one of many international flights still entering Canada, despite the federal government's plea to avoid travel.
I see these planes flying in, one after the other, and every time I look up in the sky, I'm thinking, how many cases are coming in? This has to stop. It's absolutely critical.
On January 7th, the federal government made it mandatory for airline passengers entering the country to show proof of a negative COVID test taken within 72 hours before their flight.
People aren't just staying put during those 3 days. They might be moving about, still on the beach, moving around the hotel.
During 2 weeks after mandatory testing was brought in, there were 156 COVID exposures on international flights in and out of Canada. 76 of them landed in Toronto. Of those, 10 came from Montego Bay, 6 from Cancun, and 6 from the UK, where a new COVID variant was first detected.
We're going to control these new variants coming in. We have to have kind of like a catch and release kind of system. We're creating a safe zone in Canada. And so we want to get rid of all the new variants that are already here, but we also prevent further cases coming through.
Experts are calling on the federal government to enforce a mandatory hotel quarantine for returning travelers at their own expense, a move already in place in Australia and one the UK could announce as early as Tuesday.
As long as planes keep on landing in Canada and as long as there's no mandatory quarantine in some type of federal facility, the front door is still open.
Ottawa pushed back today, saying Canada's quarantine rules are tough, but it is considering further measures.
Given the virulence of the virus in the world today, our government absolutely is looking seriously and carefully at measures to further guarantee the toughness of our border measures. We're looking at that very actively right now.
There's also a push for the federal government to clearly define what essential travel is. But Ottawa has cited banning Canadians from traveling abroad could infringe on constitutional rights.
The students received the email Sunday. They were expelled from McGill Properties for 7 days, even if this residence on Park Avenue is their only home in Montreal.
At 3 p.m. on Sunday. And most of them were very panicked because they didn't know where to go. They didn't know what was happening. It wasn't clear to them.
The university claims the students ignored warnings not to gather in groups in their rooms, a violation of the university's recently updated guidebook for residences. But it's a version of events that is disputed by several witnesses.
Some of them only had 1 strike. And the rule was previously 3 strikes. So, yeah.
The students we spoke to say they all recognize the importance of those sanitary rules, but they also question McGill's heavy-handed response to these latest incidents.
Some of these people have never gone on a strike before, so it was extremely upsetting to see that they were getting removed from residence that quickly.
It's been crazy. It's been like a roller coaster ride.
Patricia DiBiase says she's in total shock about what happened to her mother. 97-year-old Antonietta Pulice may be the first person in Quebec to receive a second COVID-19 dose, albeit accidentally.
The vaccine was a Pfizer vaccine, but she had gotten a Moderna vaccine on the 7th of January.
Pulice suffers from dementia. A resident at CHSLD Heron, she received her first dose of the Moderna vaccine.
With that facility closing, Police was transferred temporarily to CHSLD Joseph-François Perrault. Yesterday, DiBiase says she received a call that Police had been accidentally given the Pfizer vaccine.
I said, can you repeat that? And she repeated it again. I said, okay. And I said, how can that happen? Mistakes happen. Well, it's not a small mistake.
The Regional Health Authority in charge at this CHSLD says they're aware of the situation and they're investigating. They wouldn't give any further details, citing confidentiality. But a spokesperson confirms that should this have happened, they do have a procedure in place. It involves a rigorous review from the medical team, public health, and a team from infection prevention and control. DiBiase worries about the possible effects mixing the vaccines may have on her mom. Given the vaccines are so new, the answer to that is still in the air, but experts aren't worried.
It shouldn't happen, a mix-up like that, but there is no scientific reason to believe that there are any negative consequences.
The Public Health Agency of Canada says the vaccines can be mixed, but only in very specific and unlikely situations. DiBiase says she's getting regular updates on her mother's condition.
This has been a Dog in a Bonnet production, 2021.